Kia ora. Good afternoon, everyone. I'm really pleased to be here. I would guess that of the 4 talks you're going to hear today, this is probably the least understood profession. I mean, it's the least visible profession. And I just wanted to really start by saying that when I got into this profession, I didn't have a clue what I wanted to do. I got my degree from Indiana University in the mid-1970s during the Vietnam War era, and I guess when I got to university I had a vague idea of what I wanted to do, but nothing specific, and I guess I was interested in teaching. That was as far as I got when I entered university. I thought I might want to be a teacher. And I sat down with my academic advisor at Indiana, and he asked me what I wanted to be, and I told him, and he said, I think you ought to think about something else. And it wasn't because he knew me, it was because at the time teaching was a saturated profession during the Vietnam War, because most men who were of draft age were getting draft referrals from the war so that if they went on to teach. So it was a way of getting out from being a soldier during that period. And I was coming of draft age, I was 18 years old, and I didn't want to get into a saturated employment situation at all. So he sat down with me and tried to find out what I wanted to do, and I knew I wanted to work with people. I think that was the important thing. And I liked science a lot. I was good in science in high school. And he said, have you ever thought about speech-language pathology? And I said, well, no, I haven't thought about it. I don't even know what it is. I've never even heard of it. And I suppose there's people here who haven't heard of it too, even in 2014, all those years later. It's not a very visible profession. There's only about 400 speech and language therapists who work in this country. The situation's quite different abroad. In the US, there's about 125,000. Britain has about 5,000. All of the developed countries have speech and language therapy as a profession. So I really just wanted to relay that to say how important you are in influencing the lives of high school students. All it takes is a suggestion and you can literally change somebody's life. And that's exactly what happened to me with this academic advisor, whose name I don't even remember anymore, but who was probably one of the half a dozen people in my life who have influenced my decision making more than anybody with one afternoon of talking to me. So I'd like to talk to you about what this degree is at the University of Canterbury and what the profession is as well. All right, let's start with this definition. This is from the American Speech Language and Hearing Association. A speech-language pathologist is the professional who engages in clinical services, prevention, advocacy, education, administration, and research in the areas of communication and swallowing across the lifespan from infancy through geriatrics. Clearly a definition written by a committee. So if we unpack that a little bit, I think I just want to focus on several aspects of this. First of all, clinical services, because this is where most of the students that we train go into. They go into clinical services. They get into this field because they're interested in people who, for one reason or another, have problems communicating. And more recently, problems swallowing, which of course isn't related to communication in any way, shape, or form, except that for most people we communicate with the vocal tract, and we also eat and drink and swallow with part of that same mechanism. So people who have dysphagia, which is a severe swallowing disorder, usually caused by neurological damage or muscular damage to the system, in childhood or adulthood, it's our profession who works with those people throughout most of the developed world. The other aspect here is that we work with infants all the way through geriatric people, old people like me. And I mean, New Zealand, for example, has an intensive neonatal hearing screening program now where every baby born in this country gets their hearing screened before they leave the hospital. So we know now who has severe hearing impairment and who doesn't, and we can do something about that right from the beginning. Speech-language pathologists and audiologists get involved with newborn babies. And I suppose that's that end of the continuum. On the geriatric end of the continuum, it's very much a growing profession. As the population ages, there's more and more need for people in the health professions like that. So SLPs work with people who have neurogenic conditions such as stroke, Parkinson's, cerebral palsy, and dysphagia. Dysphagia is that swallowing disorder I talked about. They work with children who have developmental conditions of various kinds, such as children with autism or children on the autistic spectrum, children who have delayed speech and language development, children who have cognitive disabilities of one sort or another, and children who have motor disabilities, and people who are children who are dysfluent. And there's also people with other conditions, adults who stutter. There's been a lot of publicity, movies and things around this condition recently. People with voice problems, singers, teachers, coaches. A lot of people have voice problems that need therapy. People who have had their larynx or voice box removed altogether, usually due to cancer, head and neck surgery, and children born with cleft palate who have surgical repair of that cleft and need to be remediated in addition to having the surgical intervention. So there really is quite a range of disorders, and what we have to do is train our students within the course of 4 years to become familiar with all of these different problems. SLPs really work in a variety of employment settings. They work in healthcare settings, hospitals and nursing homes primarily, acute and chronic clinics within hospitals, education, preschools, schools, high schools, and community and university clinics. So an example of this is on campus here in my department. We have a university clinic where outpatients come, children and adults, to get treated, assessed and treated. And a lot of our students do clinical placements within that setting. And then private practice is a really growing area of the profession. There's a lot of people who I think begin in these kinds of work settings and for one reason or another move into private practice. And that can be quite a lucrative area of practice. Okay, so the other aspect of being a speech and language therapist has to do with research and education. So somebody like me, for example, my colleagues in the department all do research because we work at this university. We all educate students, and there's quite a large number of people throughout the world who are in higher education doing research in this area. And because more and more people are getting old in universities, in our field there is a huge need to have people like me replaced when we retire or kick the bucket. So we encourage our students to do research, and we try to create a research culture within our department so that students know that research is every bit as much as their training as learning about clinical services. Now, at University of Canterbury, we have 2 different degree programs where people can become qualified speech and language therapists. The larger of the 2 programs is the Bachelor of Speech Language Pathology. It's an honors degree program, 4-year program, and it's the one that I'll show you part of that curriculum in just a moment. At the end of that 4 years, students are qualified and they can go out and practice as a fully qualified speech and language therapist in New Zealand. And if they want to work in one of the other English-speaking countries, they can do that, but they have to meet the standards of those countries, and those do differ slightly from country to country. So for example, in the United States, you have to take a qualifying test before you can practice, where you don't in this country. We also have a new program. It's just run through its first year, and it's called a Master of Speech Language Pathology. It's a 2-year program, and it essentially crams everything we do in 4 years into 2 years. It's a 24-month program, so students do go during the summer months. But they sit in the same courses, for the most part, that the undergraduates do, and we train both cohorts together. So that's a degree program aimed with people who have first degrees in associated fields like psychology, linguistics, or early childhood education, and some other ones too. And I say this because it gives, our classes now have a terrific mix of students who have not only different academic backgrounds, 18-year-olds versus 30-year-olds, but they have quite different life experiences. And I think it makes the mix at Canterbury much more rewarding than it can be at some universities because of those two groups together. And we are accredited by that professional association. So the degree structure of the undergraduate program is that we have students go through a first year of courses. There's 8 requisite, required courses they have to go through these are all introductory courses: communication disorders, anatomy and physiology, neuroscience of communication and swallowing, linguistics, 2 psychology courses, and then the Science, Māori, and Indigenous Knowledge course, or a course in conversational te reo. So it's a heavy science-based curriculum, and it did not used to be this way until about 3 or 4 years ago. We did not have students, for example, take statistics a few years ago. We did not have them take neuroscience a few years ago, and they didn't have the psychology courses in the first year. It was much more open in the first year. Because the profession has grown so much, we decided to have a required first year menu of courses. So the 2nd through 4th year are the professional years, and I won't talk too much about these other than to say that it's a mix of coursework, academic coursework, and clinical placements. So right from the beginning of semester 2, students are working with patients under clinical supervision. They work in our own university on-campus clinic to begin with, and then they move off campus to schools, hospitals, private practices, and so on, all over New Zealand and North America and Britain as well, if they want to. And we have students do clinical research projects. It is an honors program. And the idea here is building that appreciation for what it is to understand research and do research. So applications are made at the end of the first year. 40 students are selected really on the basis of first year coursework performance. And normally a B+ average or better is required at the end of that first year of coursework, and fluency in English. And there is more information on our website. So thank you very much.